Good afternoon. Welcome to the weekly briefing here at the EMA office for day 509 as we bring you the latest information and updates on the COVID. Joined here with Chairman Mark Kern and Mila Blanford, the Director of the St. Clair County Health Department. Mila, you have our numbers today and some information that came out today from the Governor's office.
I sure do. We'll start with the numbers. For July the 29th through August the 4th, 2021, we have 755 new positive tests out of a total of 7,020 for the week. The age range of those positive individuals is under 10 to in their 100s. The weekly count of positivity rate is at 10.8%, with the match at the seven-day rolling average at 10.8%. Our regional positivity rate as of August the 1st was at 10.3. We have one new death to report, a female in her 80s with known health conditions. Countywide, we have conducted a total of 402,255 tests, consisting of 33,976 positives and 368,279 negatives. The total number of deaths to date is 491, and our condolences go out to those families. To date, the number of individuals who completed their 10-day isolation period is at 32,447. Statewide, we've conducted a total of 27,056,446 tests, consisting of 1,430,000 positives, 1,430,265 positives, sorry about that, which is an increase of 14,693 from last week. Total deaths to date is at 23,476, and that's an increase of 56 from last week. For St. Clair County hospitalization numbers, we have 52 COVID-related hospitalized patients in St. Clair County. Regionally, we're at 87. Patients on ventilators in St. Clair County is at 1. Regionally, we're at 5. For congregate care, those in outbreak status, we're announcing new cases only. Freebird Care, 1 new case. Memorial Care, 2 new cases. Mercy Rehab in Swansea, 5 new cases. In Sycamore Village in Swansea, 1 new case. We continue to offer testing throughout the county. St. Clair Square is open Monday, Wednesday, Friday, and Saturday from 8 to 4, as well as HSHS on Hartman Lane, MedExpress, CVS, Walgreens all offer testing options. You can continue to receive vaccine throughout the county as well. We have a drive-through location at 330 West Main. It's open Monday through Friday from 10 to 6 and Saturday from 8 to 4. In addition, you can go to our website and find other providers in the area. They can sign up. If you have any questions about vaccine or registering for vaccine, you can call our call center Monday through Friday from 8:30 to 3:30 at 825-4447. We know that we have the Delta variant, and that is growing in the numbers that we're being reported to from IDPH. Right now, the Delta variant comprises about 40% of the variants IDPH has identified in our community. We also know that our case rate, our transmission rate within the county is at high. Last week, we went through a demo on the CDC page, so you can find that information. Again, in our daily schematic that we post on the Health Department's website, as well as that you share on your EMA briefing and social media, we have that transmission level noted every day. So we're at 255 per 100,000 on the case rate. Again, that's high transmission, so obviously masking is recommended indoors in all public areas. We know that the governor just made an announcement mandating masks for pre-K through 12, as well as daycares and in all state buildings, and that we are mandating vaccine in state facilities as of October the 4th. Okay, Chairman Kern?
And I think congregate living facilities were also included, and all of this is whether a person has been vaccinated or not, they're required to wear the masks. And it really is based upon CDC guidance. The governor is leading here, and it's important. It's the Delta variant that's causing this, and certainly we know that that this variant is brought about by the fact that people who haven't been vaccinated are bringing these new variants about. So that's why it's extremely important for your community that you get vaccinated. We encourage you to do that. Health Department is offering the vaccine, continues to offer the vaccine free at their facility on West Main Street in Belleville. So we encourage you all to get out there and utilize that source.
And for Pfizer, you can drive up daily without an appointment. We do have J&J offered on August the 5th, so you can go to our website and sign up if you're interested in receiving the J&J vaccine. And you can watch the website for Moderna availability as well.
Thank you. Yeah, because we're seeing all of these positivity rates. They're double where we were last month. So this is really rising, and when you listen to the zip code report today, listen for your zip code, and you'll see significant amounts of our population that are now being diagnosed COVID positive. So in 62059, we're up 1 today to 49. 62201 is up 12 to 695. 62203 up 25 to 774. 62204 up 13 to 509. 62205 up 20 to 789. 62206 up 29 to 1,677. 62207 up 13 to 785. 62208 up 32 to 1,934. 62220 up 72 to 2,446. 62221 up 84 to 3,238. 62223 up 48 to 2,085. 62225 up 9 to 190. 62226 up 93 to 3,735. 62232 up 21 to 1,005. 62239 up 15 to 556. 62240 up 17 to 192. 62243 up 3 to 829. 62254 up 10 to 869. 62255 up 1 to 93. 62257 up 8 to 381. 62258 up 35 to 1,201. 62260 up 10 to 879. 62264 up 9 to 399. 62269 up 50 to 3,757. 62282 up 2 to 77. And 62285 up 12 to 627. So we only had one zip code this week that did not. Summerfield again came in with no increase. So good work, Summerfield. But Herb, it's pretty clear these numbers are rising. The reason we're wearing masks today is because in county buildings now we're requiring that you mask up again if you come to county buildings, and so we want to certainly abide by those rules. It's important to stop the spread, whether you're vaccinated or not. It's being recommended now by CDC, and so we're going to abide by those recommendations.
Well, and it's really ridiculous that we're having to go through this again, because we have that tool, as I've said before, and we said it many times, we have that tool available to us, and a lot of people, a lot of the Team St. Clair members have taken advantage of that, but there are still a percentage of people out there that haven't for whatever reason, and until we get that more of them convinced that this is the right way to do it, these masks are going to be around for a long time, and it's unfortunate, but I don't know what else we can do to get the word out.
And remember, there are a number of people, a good number of people in our community who cannot get the vaccine, whether for religious reasons, for health reasons, and of course if they're under 12, they can't get this vaccine yet. So the reason that people who have been vaccinated and those who aren't are being asked to mask up is to protect those people. This is really being done for others. We have been vaccinated, and we know there is a significant protection that we have against getting this variant, the Delta variant, or COVID as a whole. But we're doing this to protect others.
Well, regionally, when you look at the numbers, we're still being flagged in two categories. One is the positivity, because we've been over that 8%. As well as number of COVID patients that we see, but our hospital or ICU beds are still looking okay. We're at 28% with a threshold of 20 regionally. So, again, it's a community, it's a region that we have to work together and achieve these goals. The vaccine is available. If you're homebound and you need vaccine, reach out to the health department. We have a sign up on our website where you can go and request a mobile clinic if you're an employer who wants to provide it to your employees. There's an IDPH mobile that's come out. We're seeing an uptake in those across the board. But if you have any questions, reach out to us. We'll do whatever we can to get the vaccine to you.
Well, I think, we said all along, it's a team effort. We're all in this together. Our businesses are the ones that I really feel sorry for is our first responders, our EMS people that are out there on the front line, our nurses, the doctors that we've had on here. We'll have another physician on next week that's already confirmed to be here, Dr. Schaefer. We're trying to continue to get that word out there. If you're not going to sit here and listen to what we're giving you every week, every day when we were doing them, when we bring these doctors in who are, you talk about on the front line, they're in there. They're the ones that are making a decision on your health, whether you're going to live or die, whether you're going to be put on that ventilator. If you're not going to listen to them, I don't know what to tell you. But we'll have, like I said, another doctor will be here next Wednesday to, again, try to share the word of how important it is to get this vaccine. Dr. Schaefer's been vaccinated. Every doctor we've had on here is, they were the first ones.
And they're the ones that are out there 7 days a week. Now they're away from their families. They're all working overtime. They're putting in the extra hours that they did for almost a year and a half. And now, because people chose not to get vaccinated, they're back in. The hospital's working full-time, overtime, stressed in a stressed environment that really can be prevented with a vaccine that is readily available and is safe and is put out there every day. You have access to it. There really are no excuses. If you can get it, you should get it.
Right. Brian, you had a question?
Yeah, there's several questions coming in today. The doctors have talked about 98% of those in the hospital are unvaccinated. Mm-hmm. Do we have a similar percentage as it relates to those testing COVID positive, being vaccinated versus unvaccinated, your amount of breakthrough cases?
The number of breakthrough cases is small. It's less than 0.01%, and that's locally as well as statewide and what we're seeing. I would like to say Dr. Ezeki is also hosting a town hall tomorrow night at 6. That information is on our social media as well as the EMA page.
Good. Very good. Well, you've heard the weekly report, week 8, day 509. We're going to continue to bring you this information. We hope that we can reverse this trend because it's definitely going in the wrong way. And we can do that with your help. We've done it before. It took us a long time to do it. And we're sliding quicker than what we should be. And we just need your help. We need you to spread the word, Team St. Clair. I know we've counted on you for the last 509 days, but it's not over with yet. These numbers don't lie. 26 zip codes out of 27 in this county seen increases. To me, that's county spread. So please spread it to your friends, neighbor. I think the governor's touched on it today. Said, do everybody a favor. Do yourself a favor. Reach out to that one person, whether it be a neighbor or a family member. And if they haven't, to try to convince them that be a part of that solution and not be a part of the problem. We'll be back next Wednesday unless something happens in between with another update. Everybody have a good evening.